to strengthen or not to strengthen? That is the big question we're going to address today with strength training, part 2 of 3, the knee and the ankle, the kANKLE edition. Welcome back to the Omega Sports Learn to Run podcast. My name is Dr. Matt Meinerd, pronounced Meinerd. Hopefully you know that by now. And I'm honored to be your host. If you are new, welcome. Here's how it works. You vote on the topic, and I produce all on my social media platforms about that topic, the podcast, the YouTube, Instagram. This is your show. If you are a regular, welcome back. I'm blown away by how many people have been listening. I think we're up to 46 countries now. Fun fact, I started uploading these podcast videos to my YouTube, and what I'm starting to do now is add visuals. So I like to talk with visual explanations, and a lot of times I wish there was a visual you could see with it. So I wanted to create that option for you of maybe you wanted to watch it later and see the visuals that's going to be available on my YouTube, Learn to Run. Let's get into it. Strength training, part 2 of 3. What are the objectives? Today is all about the knee and the ankle. Of that, there's 2 main components that we talked about last time, and we're going to talk the similar theme today. We want to train the muscles how they are used in running, and we want to train the muscles more than they were used in running. How and more. A quick foundational recap. The muscles are responsible for all things movement. Any movement of our body, it's the muscle's job. There's 3 main functions that the muscles do when it comes to the body. The muscles lift your body, the muscles lower your body, and the muscles hold your body. Remember, life is just a battle against gravity. So those are the 3 functions of the muscles. What do you say we begin our tour of your body? This is where I wish I had like an Australian or a New Zealand accent. Nothing they say sounds creepy. Everything sounds amazing. I could listen to them read a dictionary for goodness sake. But anyways, so let's begin our tour. We're going to introduce you to the muscles of your lower leg, and I'm going to work in a little action. We're going to get some action in there of what the muscles do. So let's do the right leg. So start with find your right kneecap. I hope you can find that. Got it? Okay, so now slide your hand above. Right there, those muscles, that meaty part above your kneecap, that's your quadriceps. The front of your thigh, that is where your quadriceps are housed. So now, if the foot is off of the ground, open chain, or airborne, we like to call it, when those muscles activate, it straightens your knee, it straightens your leg. When you are grounded and your foot's on the ground, the muscles act to straighten your leg as well, but they lift your whole body up. Imagine you're sitting at the edge of a chair, you push down through the ground, your quads are straightening your knee, you lift up higher. So now let's make our way to the back of the thigh. That's your hammies, your hamstrings. Those are responsible for when your foot is airborne, bending, just bending your knee, bringing your heel towards your butt. And if you're sitting in a chair, how we mainly use them when it's grounded is scooching forward in the chair. You're driving your heels down into the ground, you're shifting your weight forward. That's how we mainly use the hamstrings for our body. And we'll get into how we use these with running in just a minute. Let's go back to home base. Go back to your kneecap. Work your way down and a little bit outside of your shin. From there, I want you to imagine like your ankle's like a drawbridge where you're trying to tap your ankle. When you're lifting that ankle up, where it's creasing at the front of your ankle, do you feel that muscle where your fingertips are? Push your fingers out, contract, firm up. That's your Tibialis Anterior. We call that movement Dorsiflexion. Think drawbridge, dorsiflexion. So how we use that with the foot off the ground is it lifts your ankle up. Mainly we use this during toe clearance if we're trying to not stub or bonk your toes. But if we're using these muscles when your foot is on the ground, it's mainly to shift your body forward. So imagine I'm standing still, my weight starts to shift backwards. I feel like I'm getting close to my outside of my base of support. I will then use those muscles in the front of my shins to pull my body forward, is how they use when they're grounded. And let's make our way to the back of the lower shin. We know these babies. These are the calves. What do the calves do? When your foot's on the ground, if you push through the ball of your foot, your heel lifts up, your whole body lifts up. That's the role of the calves in closed chain or when the foot's grounded. When it's open chain, when your foot's off the ground, it's responsible for the same movement, pointing your toe down. Because the ground's not there, there's not an equal and opposite reaction. My body is not going to move at all. It's in the air. But keep that in mind when it comes to grounded versus in the air. So before we get into how we should use the muscles with running, I want to go into how we shouldn't use these muscles when it comes to running. So here it is. You should not use these muscles to propel yourself forward on flat surfaces. If you lived in a world where everything was flat and there was no hills, the muscles at the knee and ankle, they wouldn't work at all as the engine. And if you listen back to last episode, it was mainly about the hip. At our hip, that's where I'm trying to get the muscles to act to propel you forward, to be responsible for moving you forward. I don't want these muscles of your quads and your calves responsible for propelling you forward, because why? They don't propel you forward, they propel you up. So we'll talk about when we use them is going up hills, but if this was a world where everything was flat, you wouldn't have to. So check back last episode if you haven't done so already. So now let's get into it. How do we use these muscles with running? The easiest way is to separate out into two phases. When we're grounded, when our body is in contact with the ground through the foot, and then when we're airborne, when we're in the air. So we're going to go through and talk about when we're grounded, how these muscles work, and when we're airborne, how these muscles work. Let's start with grounded. When our body is grounded, the quads and the calves, muscles in the front of your thigh, the back of your lower shin, they collectively work together to do two things. They lift your body up from the ground during hills, when you're going higher, when you're increasing your elevation, and they lower your body down to the ground when landing for cushion. So both these muscles, they're on team kANKLE, not to be confused with HANKLE, hinging at the ankle. This is kANKLE, knees and the ankles. They both work on team kANKLE. And team kANKLE has a mission statement. This is their mission statement. Their team, this is their job, this is their role. Quote, always on to cushion for the tush pushing, but they will work overtime for hills. Let me say that again. They spent a lot of time creating this mission statement. Team kANKLE is always on to cushion for the tush pushing. Say that 10 times fast. But they will work overtime for hills. I sound like I'm from the South there. So let's get into that. So when we are on the ground, last time I had you do an exercise where you were standing on one leg, and it's like, how do you get from point A to point B? How do you move forward? Well, if you just straighten your knee or push down through the ground and use these two muscles, you go up, right? We're not trying to go up. But what you'll see is when you are grounded, when you're first making contact with the ground, if we were to video you in slow motion from the side, and we would go frame by frame, and we would see you're airborne, both feet are off the ground, and then we would see when your foot first makes contact to the ground, if we look at the height of your head at that point, and then if we look when your foot is all the way flat, when you've transferred your body weight fully to the ground, you're not airborne anymore, you transfer your weight to the ground. That distance, that lowering, that's it. That's the cushion for the tush pushing. So that's why I like to say the quads and the calves or team kANKLE, they're like the shocks of a car. They help to absorb that impact. We don't want to wear out your shocks and use them to both propel you forward and bound and jump up and down. in addition to landing. So again, Team kANKLE is always on to cushion for the tush pushing, but they will work overtime for hills. So the second part is, let's talk about when we're airborne. When we're in the air, which muscles work? And I want you to think about this for a second, just so we have an idea of how muscles are most beneficial. Yes, they cause movement, but to truly create movement in our body, what do we need? We need a surface. We need the ground. Have you ever seen somebody parachute? Can you imagine if they were trying to run in the air, trying to move forward? They don't have anything to really push against. They have to use the air. So it's totally different. When we're in the air, we don't have a lot of room for creating a lot of force for movement. So when we're airborne, the ankle muscles, they've got one main role. That's it. They've got one main role. So you're airborne, and we talked about before, when we made contact with the ground, when your foot first made contact, let's rewind a little bit. The stage right before that, I call this the Anti-Shin bonking stage. A lot of times we'll have people that are overstriding or breaking, episode 5. And the cue that I'll give to them, which cues these muscles to work, is don't bonk your shins on the cart. And what do I mean by that? Without training, what we'll do is when we're in the air, that lead foot, that lead leg, without training, we won't use these hamstrings. We won't use the kANKLE muscles to pull your foot back towards you. We're trying to initiate movement of your lead leg towards your center of mass. And so what happens is, if you don't use these muscles and you allow the leg to keep going forward, keep going forward, keep going forward, that's where we can land and load in front of our body, which will slow us down. So ideally, how you use these muscles when you're with running is, when you're airborne, don't bonk your shins. Don't bonk your shins on the front of the cart. That will cue your hamstrings at your knee and at your hip to both extend your hip and bend your knee to make the ground come closer to you. So I hope that made sense. In the air, these muscles will facilitate landing. So we went over how the muscles work during running. Now, how can we challenge them more? How can we challenge the muscles more than running? So the 4 components, the strategies to challenge more than running, the 3 R's and the S. We can manipulate the resistance, the repetitions, the range of motion, and the speed. Let's go into those with an example. Let's start off with the quadriceps. How and more. So the quadriceps are mainly working to lift the body up during hills and lowering the body down as the shock absorber. So picture this. You are 150 pounds. And on average, when you run, you look at your watch, you see afterwards how much elevation occurred. Let's say you average 100 feet of elevation each run. How can we challenge your quadriceps more than that? Well, think about it. If we take a 12-inch step, or 1 foot, we could do 100 repetitions of that, 50 on the right, 50 on the left. That's 100 times that you're raising and lowering your body to match what you typically occur during a run. But how can we go more? Key is more. We could add more, and this is where the 3 R's and the S come in. We could add more resistance, more weight, more load to you. You could hold dumbbells. You could have a book bag. You could hold kettlebells. You could increase the challenge with more resistance. You could do more reps, more repetitions. You could do 3 sets of 20 reps of these step ups to get more than you're typically used to when it comes to running with 100 feet of elevation. You could do more range of motion, a higher excursion of movement. We could use a higher step. We could go, instead of a 12-inch step, we could use a 14-inch step to challenge more. And the last one was the S, speed manipulation. We can manipulate the speed to challenge our bodies more than running. For example, We can power up. We can go faster, lifting our body up with the lifting phase, and slower on the lowering phase. That's concentric versus eccentric. So we could go 1 second up of lifting our body up that step, powering through, but then slow and controlled on the way down. Here's the key. The slower you go on the way down, the less momentum is going to help you out, the more true of an exercise it is. So by manipulating the speed, we can challenge your quadriceps more. And how? Let's move on to the next muscle group in Team kANKLE. I almost said Hankel there. It's so embarrassing. Team kANKLE, the calf muscles. So again, similar role, same role. They lift up, they cushion when we land. So what's an exercise that we could do that would challenge it similar to running? Single leg heel raise. So you're standing up tall, you're pushing through the balls of your feet, your whole body's going vertical, your heels are coming up, and then you're lowering down. That is how we use the muscles when it goes to going up hills. So how can we challenge more? More resistance. Same story as before. I can hold dumbbells. I can hold kettlebells. I can do more reps. I can do 3 sets of 20. And remember, the key with this is single leg. When we use these muscles during running, it's 1 leg at a time. So we want to make sure we're mimicking how we use it with running. So single leg. What about more range of motion? When we're going uphill, when we're hinging at the ankle, the kANKLE, and you're leaning forward, we're asking that muscle to act in a range that's greater than normal. So what's a way we could simulate that? Yes, how'd you know? I heard you again. You are so helpful. Thank you so much for being here. Yeah, you could go off the edge of a step. You could go the heels off the edge of a step. That way there's more room. So you can drop your heel lower than the step and then raise it up higher. So you can increase the range of motion to challenge more. How about speed manipulation? What's a way we could do it here? Well, I like to think about the frequency, the how often you're activating muscles, or the step rate. We've talked before, episode 6, about cadence, your number of steps per minute. And if you do the math, it's around 180 steps per minute. That's 3 steps per 1 second. And so some people, they're just not used to moving that quickly. It's not even just about their strength or the range of motion. They're just not used to moving that fast. So you can work on this, manipulating the speed of doing these heel raises. You could work on shooting for, if you're doing 1 leg at a time, around 2 reps per second, because it's one side. You could get a metronome out, you could look at a timer, but doing it with intent, not sacrificing form, not sacrificing the range of motion, but you can manipulate the speed to challenge yourself more. Moving right along, the hamstrings, how and more. We talked about we use these during running to not bonk your shin. We're preventing that overstriding. We're bringing the leg back towards the ground near you, underneath your center of mass. So I just want to tell you about 2, because mainly last episode I talked about the hamstring is a 2-joint muscle. It crosses both at your hip and your knee, so it works on both joints. Mainly last episode, I talked about how your hamstrings are very active with the glute max, the king of the glutes, the tush, to extend the hip. So the hamstrings are very responsible for propelling you forward at the hip joint, not as much at the knee joint. But these 2 are my favorite exercises. They've actually been shown in the research with rugby teams and soccer teams of including this type of exercise preseason to prevent some of these injuries when it comes to these sports. The first one is called Nordic Curls. You've probably seen somebody do this where it requires 2 people, or you have to be creative, where, picture this, you're kneeling down on the ground, but you're up tall, and somebody behind you is grabbing onto your ankles, and then you keep your body, your hips and your shoulders stacked, and you're leaning forward, falling as long as you can until you can't anymore. Then you let go and you push off the ground and come back up. The hamstrings are working extremely hard at the knee to eccentrically lower or control you down. Fantastic exercise. And the key is you're lifting up. You're mainly focusing on the lowering, not the lifting part. You could do this on your own with belts, with straps, with things to actually counter that weight and keep your ankles down. Or another one you could do is my second favorite is hamstring curls on a stability ball. So picture this. You're on your back. You've got one of those big yoga balls, Swiss balls, I'm talking 55, 65 centimeter balls that are blown up. You've got that underneath your feet. So you're on your back, your feet are elevated. What you do is 2 steps because we get both of the hamstring actions with this. It's incredible. First, you bridge, you lift your hips up. That's extending your hip. That's using your hamstrings at your hip. And then you keep elevated. You don't lower your body down. You bend your knees. You roll the ball in towards you. And then you roll the ball out and then down. And if you want to get crazy, if you want to get wild, if you want to get how we use this muscle with running, you do single leg. So up with both hips, you roll the ball in with both, and then you lift one leg up in the air, and then you roll the ball back and then lower. Oof. That is a fantastic way to train your hamstrings how and more than running. What about the tibialis anterior? This is the last muscle that we talked about. What's its role? I haven't really talked about it much yet. What is the role of the tibialis anterior? We talked about when the foot is off the ground, it helps to do that drawbridge, to bring your ankle up, to fold at your ankle. So when we run, when is this most active? When the leg is coming through. So let me ask you this. Does the muscle group, this is a very important concept that I want to get into. Does the muscle group need to be strengthened? Does it always need to be strengthened? Well, the answer is with everything, it depends. When it comes to running, the muscles that bring your ankle up, that dorsiflex your ankle, the tibialis anterior, what's their main role? It's range of motion. We have to ask, is the role of the body part or the muscle to move just one part of your body or to move your entire body weight? So there's a point of diminishing return. The ankle dorsiflexors, that group in the front, one strength doesn't really matter. If you're weak and you have weakness, yes, that can be an issue. But if somebody can lift a 50-pound kettlebell with their front shin muscles versus a 70-pound kettlebell up, is that really going to affect the running? Again, this is activity specific. So I don't really worry about strengthening the tibialis anterior. Unless it's truly weak, and then we'll talk about in a minute, why is it weak? We have to ask why. Could we focus on other areas of the body? Could we focus on other areas that are more important, that are going to help with performance versus what's the role? It's just clearing the ankle. Let me give you another example. So what about holding your head up while running? The muscles on the back of your head, they're responsible for holding your head up. Would it help at all to strengthen those muscles? Think about it. They have a role. It's just to hold the weight of your head. I got a big noggin. It's like 15 pounds. So would it be helpful if I had more strength than necessary to lift my head up? Not really, right? It's just, what's the role? Is it a range of motion? Is it holding something up? Is it producing force? But again, this is activity dependent. Those same muscle groups, where does a sport or a time that it could be helpful? Not with running, but where it could be helpful. Think about wrestling. If someone has you pinned on the ground and you're trying to get out of that pin, you're then grounded. Remember, airborne or in the air, open chain versus grounded, closed chain. You could try to wiggle out of that headlock. Maybe you're not allowed to do headlocks in wrestling, UFC, whatever. You could use your head, those muscles on the back of your neck, then to try to create movement to escape. So that is an example where, yes, strengthening the muscles in the back of your neck could be important. But when it comes to running, it doesn't really help. So again, we have to ask, what's the demand of the activity? What's the role of the muscle? So I want to give you an example of those same muscles back to the tibialis anterior, the muscles on the lower shin. So maybe not with running, having more strength could be beneficial, but what's an idea, just like with the wrestling for the neck, What's a time or a sport that it could be beneficial? Think about it. What about an aerialist? My girlfriend's an aerialist. I love watching. She'll use those muscles in her ankle to hold herself up. She'll grab the silks with those muscles. So she'll help use those to lift her body up. So think about uneven bars in gymnastics. There are times that strengthening these muscles can be beneficial, but we just have to ask, what activity is it? What is the demand of the activity? So it brings me into another really important concept that I want to talk about. I think this is so, so important. And I'm going to give two examples of it. If the muscle is weak, why is it weak? Let me say that again. If a muscle is weak, why is it weak? We have to ask that question. I'll give two examples, two clinical examples. And this is all boiling down to, if it's weak, should you strengthen it? That's kind of the old school mentality. Oh, it's weak. It must just need strengthening. Why? We have to ask why. Two examples. The first one is your knee hurts. You have knee pain. You go to the physical therapist and we look at your exam. We look at your range of motion. Your motion's pretty good. But yes, your knee hurts and you've got pain on the front of your knee. And we do some testing and we look for symmetry and we see that it's weaker on the other side. That's how we compare. We look to your other side. We say, yep, there's a difference. So what a typical session people would do is they would what? Let's strengthen the knee. Strengthen it. So we give them exercise for home. They're strengthening their quadriceps. They're doing single leg reverse lunges. They're doing sit to stands with one leg. They're doing long arc quad. They're doing all the things for strengthening their quad. They come back visit too. How you doing? I don't know. I think better. Let's check your strength. It's the same. Well, let's keep going. Let's do it again. Let's do more. Let's do more. They come back another time. No different. We start to ask, I wonder, maybe they're not doing their home exercises. Maybe they're not being a good patient. Maybe not. Why? We have to ask, why are those muscles, why is the knee weak with extension? Why are the quadriceps weak? Are we treating the symptom or are we treating the cause? Pain can cause weakness. If something hurts, it can zap our strength. So if we're not addressing, if we're just strengthening this leg that's weak and we're not getting anywhere, we have to ask, what's causing that weakness in the first place? So what do? We look at their running. We look at their running, and of course, because they have never learned, they haven't been trained yet, they're bounding, they're jumping with running, and their posture, they're braking or overstriding. Because nobody yet has taught them. That's my job to teach you. So with jumping and braking, tremendous amount of stress on your knee, an unbelievable amount of stress repetitively over your knee. So that essentially they're using their knee not just to cushion the tush pushing, they're using their knee, and not just with hills, to move forward. Thousands and thousands of reps per mile. And so once addressing that, let's go over your mechanics. Let's teach you how to glide. Let's teach you how to use your tush. Let's not use your knee and your calves to propel you forward. Once we address that, that's it. We've got to stop wasting people's time strengthening things that hurt. We have to ask why? Why? What is the cause? Silent culprit, noisy victim. What is the causation? Let's go over the second concept. Similar situation, somebody comes in, they've got quadriceps, same weakness. We look at them side to side. We do some step down tests looking for asymmetry. We time, how long does it take you to get 10 reps on your right leg versus your left? And we see it's weak. So same story. We're like, well, let's strengthen this. So we keep strengthening, we keep strengthening, we keep strengthening. We look at their running mechanics. We've learned this time they're actually not bound. They've been following Learn to Run for a while. They're gliding. They've got the kANKLE posture. They're not bounding. They're pushing with a tush. But why is it weak? We're like, well, I don't know. It just must be something weird. This must be some anomaly. This can't be normal. Let's keep strengthening. Session 2, session 3, session 4. We're strengthening. We're strengthening. We're strengthening. It's still weak. Well, what have we not looked at yet? Ideally, we should, but this is typically what happens. We've got to look at the back. What else can inhibit strength? Pain can inhibit strength, but also injury or pathology can also inhibit strength. Your low back It's kind of like the circuit breaker at the house. Each level is responsible for giving power to a different part of your leg. You can have a lack of power going to the leg from the back. And I've had this before where, like, why are we just keep strengthening? It's not getting better. Oh, let's look at the spine. Doing some simple extension exercises, finding the right movement for their spine. What happens? The strength comes back. The strength came back. And sometimes in those situations, once they get their back right, then they're stronger on that side than the other side. So all that is to be said, we have to ask, are we strengthening for rehabilitation, or are we strength training for performance? Big difference. There's definitely a time and a place, but please, if you've been to someone or you're injured now and you just keep trying the same thing and you keep trying to strengthen, it's not getting better, see someone that can help. Let's not just treat the symptoms, let's treat the cause. And to be brutally honest with you, this example here of treating symptoms, I have the greatest job in the world. I love being a physical therapist. But I got to the point where time after time, I felt like I was just treating things that already happened. I was just treating symptoms. And so I left the job, I left the profession 4 months ago to do this, to try to get this information out there to other clinicians, to you as runners. The more people know about this, we can stop wasting time and wasting time away from running, because we know you run for your mental health. We all know that. That's why I run. There's so many benefits of physical exercise. So I couldn't go on any more of just treating symptoms. I'm like, how can I get to more people? How can I increase my platform? How can I extend my reach? Teach the teachers, social media. That's the reason why I'm doing this, is because I truly want you to help. And the thought of somebody not getting the help that they need or doing what's not necessary and actually hurting them, that's what gets me up in the morning. That's what gets me doing this. So again, that's my tangent. If we're strengthening, why? Is it for rehabilitation or for performance? Whew. So do you want to know what the recipe to run smarter, safer, and faster? Here it is. It's 4 steps. Step 1, you join the Learn to Run Club. Step 2, you fill out a goals and a history intake. Step 3, you film yourself running. Step 4, we have a Zoom session and we go over your mechanics, we go over your intake form, your goals, and then I set you up on one of the training plans in the club. I give you resources that are valuable, that pertain to you. We share the screen, I get to meet you. It's a beautiful thing. It's finally what I've been working on for a couple of years now. I wanted to have the resources available and to be able to get people what they need fast. It's going on. I've got so many success stories in the club, and I love being able to help you be successful. So consider joining the Learn to Run Club, where I can meet with you one-on-one. I tell you how to video yourself. I can literally walk you through no matter what part of the world you're in. I've been with people in Tokyo, Calves, all over the world. And you can visit www.l2, the number 2, rc.com, learntoronclub.com, l2rc.com. I want to thank my friends at Omega Sports. They have been keeping the Carolinas moving forward for over 40 years. I highly recommend checking them out locally or online. Of note, the views and opinions of the show do not reflect those of Omega Sports. For better or for worse, they are my own. I really hope you enjoyed today's episode. I love creating these for you. If you want to vote on the topics, you can follow me on my Instagram, learn.to.run, or you can email the show at info@learntorun101.com. That'll be in the show notes. And again, I never thought I'd be this person, and I've listened to thousands of podcasts. It truly does. If you really want to help me out and extend my reach, I don't care if you never purchased something my whole life. I just want you to get value and to get help. But what you could do for me is help to rate and review the podcast. This will help to expand the reach, to help more people discover the platform, discover how to run. I would so appreciate if you could rate and review the podcast. The Omega Sports Learn to Run podcast is available on all major platforms. Until next time. Bye.